This clip was taken from the film The Theory of Everything, which is about a physics professor named Stephen Hawking who developed theories about black holes and the universe. Based on Stephen Hawking's symptoms in this footage, it is hypothesized that he is suffering from a type of motor neuron disease called amyotrophic lateral sclerosis. Motor neuron disease is a neurodegenerative disease that affects the brain and motor neurons of the body. The term neurodegenerative means that over time more and more motor neurons gradually stop working. This causes symptoms to worsen until the patient eventually dies from the disease and/or its symptoms. Amyotrophic lateral sclerosis affects the motor neurons. Motor neurons are responsible for the initiation of voluntary movement. Motor neurons extend from the brain to the spinal cord and from the spinal cord to the muscles of the body. There are two types of motor neurons: upper motor neurons, which are the neurons that transmit motor information to the spinal cord from the brain, and lower motor neurons, which transmit motor information from the spinal cord to the muscles. Amyotrophic lateral sclerosis destroys both types of motor neurons. This means that motor information in the brain cannot be sent to the spinal cord, and motor information traveling through the spinal cord cannot reach the muscle to initiate movement. Due to this lack of movement, muscle fasciculation develops. Muscle fasciculations are uncontrollable muscle twitches. These muscles also undergo atrophy as a result of the lack of stimulation. Atrophy means the muscles waste away. The motor neurons affected by amyotrophic lateral sclerosis are located in the spinal cord and the cerebral motor cortex. The brain and the spinal cord are the two components that make up the central nervous system, as shown in red. Amyotrophic lateral sclerosis also impacts the somatic nervous system, highlighted in yellow. The somatic nervous system is a subdivision of the peripheral nervous system that is responsible for initiating voluntary movements. The degradation of motor neurons in the central nervous system means that the signals of muscle activation that come from the brain cannot reach the somatic nervous system, and therefore the body is unable to initiate movement. The brain sends these signals to activate the muscles for movement via what is called the corticospinal tract. The corticospinal tract is like a pathway that motor instructions travel through to get to the muscles. The function of the corticospinal tract is to control discrete movements. Discrete movements are movements that all share the same goal but involve several muscles and joint rotations, such as throwing a ball. The corticospinal tract begins with the upper motor neurons in the primary motor cortex, which is coloured in dark green. When the primary motor cortex and the supplementary motor cortex plan a movement, they generate an impulse in the upper motor neuron that travels down its axon. The axons of the upper motor neurons pass through the corona radiata in light green and the internal capsule in light blue, then through the crus cerebri of the midbrain highlighted in dark blue, until finally they reach the ventral pons which form the pyramids, which is coloured in purple. From here, most axons undergo decussation. Decussation means to cross over or form an X. They then enter the lateral corticospinal tract in the white matter, to the side of the pyramids in pink. It is here that the axon of the upper motor neuron reaches the lower motor neuron, which is located in the ventral horn of the grey matter, which is circled in turquoise. The impulse of the planned movement is passed on to the lower motor neuron. The axon of the lower motor neuron extends through the anterior root nerve outlined in orange, then through the plexus, which is a network of nerves coloured in brown, followed by the peripheral nerves outlined in yellow, until it finally reaches the neuromuscular junction coloured in black, where impulses originally sent from the premotor and motor cortex is transmitted to the muscles, which results in movement of that muscle.
Symptoms of motor neuron disease. There is a large variation in the way that motor neuron disease affects people, including differences in the rate of progression of the disease and the regions of the body that become affected. Amyotrophic lateral sclerosis is a subtype of motor neuron disease which is characterized by the degeneration or cell death of both the upper and lower motor neurons located in the central nervous system. The consequences of this type of motor neuron disease is both a weakness and a wasting away of the muscles, as well as a stiffness of the muscles, difficulty with speech, and difficulty with swallowing. Basically, a loss of most voluntary movements and some involuntary movements. There are various ways to determine if the primary damage is occurring in the upper motor neurons or the lower motor neurons. When lower motor neurons are damaged, the connecting muscle is wasted and weak. This weakening of the muscle can also be accompanied by the flickering or tremoring of the muscle, which is also called fasciculation. This is often an indicator that a muscle is losing or has lost its nervous connection. Patients will experience difficulty picking things up, using fine motor skills, walking, or moving the muscle involved in speech, creating difficulty in speaking, like slurred speech, for example. When the upper motor neurons are damaged, the affected muscle groups can become stiff because the brain cannot provide the inhibition necessary for normal limb control. This results in difficulty doing everyday tasks and overall movement. The main characteristics of motor neuron disease include weakness of the muscles, spasticity, stiffness, mobile limitations, communication deficits, dysphagia, respiratory compromise, sleep disorders, fatigue, pain, total or partial paralysis, cramps, and muscle twitching. The long-term effects of motor neuron disease. Currently, there is no cure for motor neuron disease. The patient will need continuous support, increasingly so as the disease progresses in completing everyday tasks. The long-term effects of this disease are numerous. Independence becomes taken away. They may be unable to work, to drive, go out, or do anything for themselves. Mental health is affected. The initial diagnosis has a major and lasting psychological effect on an individual and impacts the way in which they see life. Diagnosis brings with it shock, affecting their mood dramatically, and giving them a feeling of loss for their futures. As the disease progresses, giving up most daily activities will be unavoidable, leaving them experiencing anxieties about their future, prospects, and depression at not being able to do things they were once able to do. They may also experience panic attacks, especially when it comes to difficulty in breathing. The patient will experience weight loss. Muscle mass is lost to atrophy. The muscles waste away due to the underactivity. Eating may become physically difficult, including both being able to carry food to the mouth, chewing, and swallowing. Weak lips prevent good closure of the mouth, jaw weakness for chewing, tongue weakness for maneuvering the food. They may also experience dysphagia, a sensation that swallowing is difficult, and as well as trouble swallowing, such as coordination difficulty, which can lead to choking, resulting in a fear of eating. Enteral feeding may be required if the individual loses the ability altogether to eat. This is where food is directly delivered into the stomach. Breathing difficulties occur. Weakness in the muscles of the chest cavity, chest wall, or diaphragm can result in difficulty breathing. Weakness in the diaphragm leads to shallow breathing because the chest muscles cannot expand very well, resulting in the exchange of oxygen becoming inefficient. Lack of oxygen will then lead to lethargy or tiredness, headaches, or appetite loss. Motor neuron disease does affect the lifespan and can result in death. This is primarily due to the respiratory failure. Individuals can experience sleep disturbances. They can experience sleep fragmentation, and this is largely due to difficulty in breathing. They will wake frequently in the night. This is because the weakness in the diaphragm muscles is particularly apparent when one is lying down, because the chest will struggle to expand up. Cramps and fasciculations are experienced. These are irregular and chaotic twitching of muscle fibers or shaking of muscles, and spasticity also occurs when there is increased resistance to passive movement. Cramps can be very painful. Immobility increases the likelihood of them because it raises the tension in muscles during movement and the shortening of tendons. The patient will also experience a loss of energy or fatigue, and they may also have trouble speaking. The muscles of speech and swallowing can be affected by the lower motor neurons damage, resulting in the tongue becoming wasted and weak. Therefore, the speech can often sound slurred, and there will be a physical difficulty in pronouncing words. This can contribute to a loss in social interactions with others.